we're on the record at 4 p.m. on June 26, 2025. This is a Zoom recording of Dr. Gordon Say, MD, the court reporter is Bonnie Smith with American Court Reporting. Will counsel please introduce themselves and state any objection to the witness being sworn in remotely?
James Potts, no objection.
Spencer Bomar, no objection.
Olivia Beckett for Piedmont Healthcare, no objection.
All right, Dr. Say, do you swear the testimony you're about to give in this cause will be the truth, the whole truth, and nothing but the truth?
I do.
Thank you.
Thank you.
Your name is Gordon Say,
Yes.
and it's spelled Gordonsze.
Yes.
And your specialty is neuroradiology.
Yes.
And
Yes.
you realize your deposition is a public document.
Yes.
It will be available to your colleagues,
Yes.
students you may teach,
Yes.
prospective patients,
Yes.
other physicians,
Yes.
and your boards.
Yes.
And you're a member of ASNR, is that right?
Yes.
Also RSNA.
Yes.
You understand your deposition will be available to your specialty boards, those boards.
Yes.
I'm going to show you what's been previously marked as Exhibit 1.
Okay.
What I'm going to do, Dr. Say, is share these via this chat.
Okay.
And you're welcome to open this. I'm also going to open it for everyone. If at any time you have an issue seeing what's on my screen, you let me know, raise your hand, whatever it takes.
Thank you.
Yes, sir.
Are you sharing? You're sharing, right?
Sir?
You're going to share, right? Whatever you want.
Yeah, I am.
Yeah.
It's taken me, I'm the only person in my office that prefers a notebook to a desktop. So
Okay.
let's
Yeah,
fix
that's my CV. And if you go to page 3, I'll tell you if it's the latest version.
Okay. Can you see that all right?
Yes.
Okay.
3. Yep. Yep. That's the latest version.
All right. And that accurately reflects your education, training, and background?
Yes.
We'll mark that as Exhibit 1 to your deposition. You're not a neurologist,
No.
not a neuropsychologist,
No.
not a psychiatrist,
No, I'm not.
not a pain management doctor.
Correct.
You've never treated a cervical epidural steroid injection,
That is correct. Yes.
never performed one,
Never performed one.
never taught one,
Correct.
never published anything on a cervical epidural steroid injection.
Correct.
You're not a treating physician.
Correct.
You've never treated Arlina Addison.
Correct.
And in addition to never performing a CESI, never having taught one, never observed one, you've also never seen a patient exhibit decerebrate posturing in your presence 90 to 120 seconds after a cervical epidural steroid injection.
Yes, that is correct.
Have you ever had a patient exhibit decerebrate posturing in your presence?
Well, let me put it this way. Yes, when I was as an intern in internal medicine, yes. Other than that, no.
Okay. And what year was that?
Oh, that's a long time ago. That would be 81, 82.
So 81, 82, that's 20, 45 years ago. 40.
20 years ago. Yeah.
Yes, sir.
Hmm.
So you agree your experience with what happened in this case is 0?
Well, first of all, my area of expertise is the film, so I interpret the films. I also have some experience doing procedures that have to do with the spine. And so to the extent that they are at all relevant, I'll discuss those. But yes, I'm not going to discuss the clinical or what Dr. Sanders discussed as to whether or not it was decerebrate posturing or something else.
Yes, sir. And thank you. You answered that question. My question was a little different. You're not a treating physician, right?
Correct. Yes.
Not a neurologist.
Correct.
Not a neuropsychologist.
Right.
Not a psychiatrist.
Right.
Not a pain management physician.
Correct.
You never performed a cervical epidural steroid injection.
Correct.
Never taught one.
I have nothing to do with them. That is correct. Yes.
Yes, sir. Never observed one?
Correct. Mhm.
Never seen a patient seize and exhibit decerebrate posturing 90 to 120 seconds after the cervical epidural steroid injection, right?
Correct. Yes.
So your experience with what happened here is zero.
Back to form, James, I will stipulate, we're not calling him as a standard of care witness or as a witness providing clinical opinions. He's strictly here to talk about his interpretation of the radiology.
All right, you may answer.
Yes, that is correct.
Okay. And you said some 40 years ago, you seem to recall that a patient exhibited decerebrate posturing in your presence. Is that right?
I mean, when I was an intern, yeah, sure.
Okay. Do you remember where that was?
Well, I did my internship at UCSF.
Yes, sir. And was it in the hospital?
Oh, yes, definitely.
Okay. Was it a male or female?
Oh, you're talking about 40 years ago. I have no memory.
Okay. So you don't remember whether it was a male or female?
No, I don't remember.
You don't remember the age of the patient?
I don't remember any details. I just know about decerebrate posturing and having seen it.
Race of the patient?
No memory.
No memory of it.
No memory.
Yeah. How do you know that you were present when a patient exhibited decerebrate posturing?
Well, you're talking about clinical things, which are really not my area of expertise. I mean, I know about decerebrate posturing and decorticate posturing as far as a neuroradiologist goes, but that's really the extent of it. I'm not going to be commenting on any of this.
Yes, sir. And you weren't, of course, present on June 9, 2022, right?
Correct.
You've never met Arlina Addison,
Correct.
never spoken with her,
Correct.
never took her history,
Correct.
never examined her,
Correct.
never spoken to her daughter, Hillary.
Correct.
You've never spoken with Dr. Lee,
Correct.
any of the nurses performing?
I've never spoken with anybody in this case except for Mr. Bomar and maybe people in his firm.
And Mr. Bomar is the defense lawyer that hires you.
Yes.
Okay. Never spoken with her neurologist.
I have never spoken with anybody in this case except Mr. Bomar and people in his firm.
Okay. Her psychiatrist.
No.
Emergency room team.
No.
What about the board certified radiologist and neuroradiologist who read her films on June 9, 2022?
As I said before, I've never spoken with anybody else in this case, other than people in Mr. Bomar's firm.
Yes, sir. You've reviewed the reports, is that right?
I actually have reviewed only the reports that were in the depositions. I actually have not reviewed the official reports otherwise.
Are you prepared to give your full and final opinion today?
Yes.
Okay. So you've reviewed what reports?
Well, the report of the first CT scan is in the one of the depositions, so I reviewed that.
Yes, sir. Any other CT scans?
No, I have not reviewed the reports from the others. It's all my opinions.
Don't you think it's imperative that you review all the CT scans and MRIs?
Well, I reviewed the scans, yes. You're talking about the reports, the official reports.
So you looked at the films?
Oh, of course, yeah. I looked at many times, yeah.
Yeah. And when were those provided to you?
Oh, from the very beginning of the case.
When was that?
Let me see. The letter dates from February of 2025.
February 2025.
Yes.
You were provided with all of Arlina Addison's CTs at that time?
Yes, all her imaging.
All the MRIs
Yes.
and all the CT angiograms, CTAs, is that right? She can't take my head nod. Got it. Okay. And what's your understanding about why those weren't provided to us, the lawyers on behalf of the plaintiff?
They were not provided to you?
What's your understanding about why they weren't provided to us when we requested them in discovery?
I had no idea.
Okay. So Mr. Bomar had them. He provided them to you, right?
Well, actually, are you talking about the films? You're talking about the films now, right?
Yes, sir.
But yes, he provided them to me.
Okay. So Spencer Bomar had them in February 2025.
You know, I have, well, presumably, yes, because I got them. But
Yeah, he gave them to you. He had to have them to give them
Let me
to
finish,
you.
please. No knowledge of whether or not he provided them to you. This is totally outside of my area. I'm really here to talk about the films and maybe a little bit about how, you know, spinal procedures are done, and that's it. I have
Yes, sir.
no knowledge of all these extraneous things.
Okay. Do you recall testifying in Hathaway v. Lewis?
Hathaway is familiar, yes. Mhm.
Yes, sir. And do you recall being accused of giving false testimony in that trial?
Absolutely not. I do not remember that whatsoever. And I would like to see what you're talking about because I always say the same things in my depositions and I'm always 100% truthful.
Mm-hmm.
So I would really like to see what you're quoting.
Do you recall testifying in the Byers case?
I don't recall that, but the name is vaguely familiar.
What about the Tylenol MDL?
Yes, the series of cases is familiar. That's quite going back a long time. Yes.
Yes, sir. Do you recall your opinions being prohibited by any federal judges?
No, I don't recall that. Now remember, you cannot do this very long without having in court somebody say, please limit your opinions to such and such. So
Yes, sir.
happened, but other than that, no.
You don't remember a federal judge limiting your opinions? In
Well,
any case?
I think that I've already answered that question.
No, sir, you haven't.
Well,
I think you testified that you do not recall any federal judge in a courtroom in this country limiting your opinions. Is that
I've
right?
already answered that question. Let me finish, please.
Sure.
You cannot do this without a judge saying, please limit your opinions to radiology, for example, or something like that. That does happen.
Okay. And you recall that happening to you?
Sure, but it happens, I think, routinely. I mean, I think this is a very common thing.
And you recall it happening in the Byers case?
I don't recall specific details about Byers.
You also recall it happening in the Tylenol MDL?
No, I don't recall that at all.
What cases do you recall it happening in?
I just know that from my experience, it's not that uncommon when you're in court for the judge to say, you know, for the other side to complain that you're talking about something clinical, and for the judge to say, please limit your opinions to radiology, which I would hope to do so in this case as well.
Yes, sir. And do you recall, I believe you testified earlier, you reviewed the reports for Arlina Addison's CTs, MRIs, and CTAs, is that right?
No, you misquoted me. I've reviewed the films. I have not reviewed the reports, except that the report for the first CT scan was actually quoted pretty substantially in one of the depositions. So I reviewed.
Right. And have you reviewed any of Arlina Addison's medical record from June 9, 2022, other than that report that was quoted in the deposition?
Yes, I reviewed the reports from the what is it called, Austell Surgery Center.
Yes, sir. The medical record?
Yeah.
About 60 pages, 50 something, 52.
I don't remember, but it's not that long. So.
Right. And do you recall when you reviewed the CT reports that you did review, was the word artifact ever used?
That I don't remember. It may well have been.
Well, we can have a look. I'm going to show you what's been previously marked as Exhibit 2. This is Arlina Addison's Wellstar medical record. Do you recall whether you reviewed this?
I think I've answered that question already. I reviewed the report from the CT scan because it was in the deposition, but I did not review other materials from Wellstar.
All right. Artifact. Do you know what an artifact is?
Of course, yes. It's something that is a technically produced false finding.
All right. And if you see something like that in a film you're reviewing, you, of course, you're duty bound to note that, right?
Well, if it's significant, if it's something that we see all the time, you don't necessarily have to report it.
All right. And you don't recall in the report that you read the board certified radiologist or neuroradiologist using the word artifact, right?
I don't recall offhand. That is correct. It's a common word to put in, so reports, so I just don't remember.
So we can search this entire medical record quickly, and it's not there. So that comports with your memory, right?
Yes, I guess so.
And I believe I saw in your a portion of your opinion, which we'll get to a bit later, that you suggested there was both blood and dye in the brain on June 9, 2022. Is that right?
I think it is essentially dye plus air.
Dye plus air.
Yes.
So dye, that doesn't show up either, does it?
No, but contrast will.
Sir?
Contrast will. Put in contrast.
Yeah, you're talking about the contrast intentionally administered at the hospital.
No, I'm talking about the contrast that Dr. Lee administered.
So you're saying the contrast in this medical record is a contrast that Dr. Lee administered?
No, there are two types of contrast in this record. There's a contrast that was given at the hospital, and then there's a contrast that Dr. Lee administered.
Right. And the contrast you're talking about is the contrast that Dr. Lee administered.
For the purposes of the first CT, that is correct.
Okay. And you're suggesting that that is the omnipaque dye, is that right?
Yes.
Okay. And let's see. Omnipaque, that doesn't show up either, does it?
No.
Okay. And you recall that there was a CT taken before contrast was administered and a CT was taken after contrast was administered. Is that right?
Yes, the CT angiograms are always done with contrast.
And have you read Dr. Harper's deposition?
Dr. whose?
Harper?
Harper, no.
Do you know who Dr. Harper is?
I do not know who Dr. Harper is offhand, no.
Okay. Dr. Harper is another defense expert in this case employed by Mr. Bomar.
Oh, okay.
Harper, does that ring a bell at all?
To me, no.
Okay. And you were never provided with a copy of his deposition?
Yes, you're correct.
And at the same time, you're prepared to give your full and final opinion today without having read it. Is that right?
Yes, because my opinions are based on the films.
Okay. So were you aware before now that Dr. Harper testified under oath that there was no contrast in the June 9, 2022 film?
No, this is the first I've heard.
Object to form, misrepresents the testimony.
Is that something you would expect would be shared with you?
Object to form.
I don't, this is the first I've heard of it, so I don't know. I don't know the details.
Why don't I see if I can help you with that? Would you want to be informed about testimony that's that significant in this case?
Object to form, argumentative.
Well, I don't know who Dr. Harper is. Is he a radiologist? Is he a treating radiologist? Is he, I don't know who he is.
Dr. Harper is a pain management physician that performs cervical epidural steroid injections. Were you aware of that before today?
No, I told you I never heard of Dr. Harper before.
Right. And do you perform fluoroscopy?
Yes.
Okay. And do you agree that if there was no omnipaque administered by Dr. Lee, it'd be impossible for it to be in Arlina Addison's skull when she got to the hospital, right?
That is a hypothetical, and if there were no omnipaque administered hypothetically, you are correct.
Okay. I'm going to show you what's been previously marked as, is this 3, Madam Court Reporter?
That's correct.
Thank you. This is a deposition of Dr. Harper. Well,
Yes, I've not seen this.
okay, so it's first you've seen it today, is that right? At this deposition, is that
Yeah.
right?
Okay.
This is page 7. You defer to a radiologist on the differentiation between, say, blood and omnipaque or dye. Yeah, and a CT scan view, certainly. But we're not talking about a CT when Dr. Lee injected Arlina Addison in the neck. That was a fluoroscopy, which is not a CT, right?
Right, but I can tell you that there is evidence of contrast being injected on both the fluoroscopy and on the CT.
You're telling me that there's omnipaque and on both the fluoroscopy and the CT, is that right?
Yes, I basically agree with what Dr. Austell said about the CT, that there is contrast there.
So I'm going to show you what's been previously marked as page 58. Do you see that,
Yes, can you enlarge this a little?
sir?
Can you enlarge it?
Oh, sure. You
Great.
see where it reads 58?
No, enlarge the whole thing, a little larger.
First of all, do you see where it reads 58 in the upper right corner?
Yes, I do.
Okay. And then we scroll down to the bottom. Is that big? Can you see that?
I can.
And at line 10, you agree, I know you testified there's no contrast in this film. You agree that CMS also requires, in addition to the 2 views, the use of contrast. Is that right? Yes. And of course, there's no contrast here. Is that right? No. Well, you agree there's no contrast in this film. I don't see any contrast. Do you see that?
Yes, I do.
So that's another defense expert that does this. I think he testified he'd done it about 250 times. He said there's no contrast.
Object to form, misrepresents the record.
Defense Act, don't interrupt me again, Mr. Bomar. Would you read back my question, please, Madam Court Reporter?
Question, so that's another defense expert that does this. I think he testified he's done it about 250 times. He said there's no contrast.
And I'll object to the form of the question to the extent it misrepresents the entirety of his testimony and that this question is based on one snapshot of the procedure, not the entire study.
Doctor. You see that all right?
Yes.
Okay. Have you seen these videos of physicians' depositions on YouTube on our channel?
Of the physicians in this case?
This or any other case?
No.
Okay. You see where it reads, well, you agree there's no contrast in this film, right? And he says, I don't see any contrast. And you weren't told that before today, is that right?
No, but he's the defense expert, but ironically, the plaintiff's expert agrees there's contrast.
The plaintiff's expert what?
Agrees that there is contrast.
Yeah, what plaintiff's expert is that?
Austell.
And you reviewed Dr. Odestat's deposition transcript, is that right?
Yes, I did.
And point me to the portion of the deposition transcript where Dr. Odestat said that there's contrast in that June 9, 2022 film.
Okay, I have to find it.
Sure, take your time.
Take yours down and I'll put it up, okay?
What's that?
Take your exhibit down so I can put mine up.
Sure, as soon as you find it.
Okay. Give me just a moment here. Okay, here we go.
Sure. Well, Mark, whatever you're looking at as exhibit, is this 4, Bonnie?
That's correct.
Okay. There's actually a lot of discussion about the contrast, but
Sure.
one I could find quickly, and I will find more if you want, is here on page 63, where he says, we have pretty clear post-procedure clinical evidence of an intrathecal injection. Here it is. We have post-op CT showing contrast.
And you said that Dr. Odestat testified that there was contrast in the June 9, 2022 film. Show me that.
Okay, give me just a moment.
Sure, take your time, but don't do this again. Don't falsely claim that something's being said when it's not being said.
Objection.
What another doctor say?
I'm sorry?
Would you read that back, please, Madam Court Reporter? My question.
Question, sure, take your time, but don't do this again. Don't, falsely claim that something's being said when it's not being said.
Okay, so first of all, it wasn't a false claim. I just have to find it. Let me find it. Oh, can you still see? I'm still sharing, right?
Yeah, I can see it fine.
Here it is. Here it is. Okay, so he's talking now about the
For the
fluoro
record, you're at what page, Dr. Say?
75 and 77.
Uh-huh.
He's talking about the fluoro, which you can see here, right? And he says that there's a little bit of darkness, and I think what he's saying is this could be a little spot of
No,
contrast.
I don't want you to think what he's saying. I want you to show me where he testified under oath.
I am Mr. Potts.
Don't interrupt me again, Dr. Say. I want you to show me where Dr. Odestat testified under oath that there is contrast in the June 9, 2022 film before Dr. Lee injected this woman and her cerebrospinal fluid.
Okay. right here. So presumably he got that contrast shot, advanced the needle more, and gave a second round of contrast. Right there.
He's talking about what he wrote.
I'm sorry?
He's talking about what Dr. Lee wrote. Have you spoken to Dr. Lee?
No, you asked me already. I said no. But
Okay.
let me finish. This is not what he wrote. This is his, this is Dr. Odestad's interpretation.
Hmm.
Is
All right, where else do you see anything that suggests in any way that Dr. Odestad testified under oath that he saw a contrast on Dr. Lee's June 9, 2022 film before he injected this woman into her cerebrospinal fluid?
okay. Here it is. It's on page 82.
All right. Yeah, I'm waiting, doctor. When did he testify there's contrast in that film?
I thought you were reading this. My apologies. Here it is. So this is his response. So that's how I know of that dark shadow is contrast.
And you're saying that he testified that's contrast on the June 9, 2022 film, right? All right. Where else?
I don't think that there's any place else that I recall. Those are the places I recall.
You recall reading the one report that you did read where it reads blood
Yes, I recall that.
and where it reads subarachnoid hemorrhage?
Yes, I recall that.
And there was nothing there about artifact, omnipaque, or dye, right?
Yes, you are correct.
And there was nothing there about maybe dye, right?
You're correct.
Nothing about, I'm unsure whether this is blood or dye, nothing remotely akin to that, right?
Correct.
And nothing suggesting that some of this blood may be mixed with dye, right? I couldn't hear you.
Correct.
Okay. Now, you've never reviewed Arlina Addison's MOCA, M-O-C-A, is that right?
Correct.
Do you know what a MOCA is?
I read about it in one of the depositions. It's a clinical thing. It's not in my area of expertise.
Okay. And you've reviewed her neuropsych testing as well, is that right?
No, I did not. I just reviewed the depositions.
Yeah. Do you know what a Hounsfield unit is?
Oh, of course, sure.
What is it?
It's a measure of density on CT.
Right. And that's something that's available to you when you're reviewing a CT, right?
Yes, it is.
It was also available to you when you were reviewing the CTs in this case, right?
Yes.
And you recall the Hounsfield units when you were reviewing the CTs in this case?
I did not need to use Hounsfield units, but it would be very easy for me to do so should I choose to do so, but I didn't need to use Hounsfield units.
So you didn't use them, is that right?
That is correct.
And the reason is you just didn't feel like it?
No, the reason is that, first of all, we don't routinely do them in our daily work, although we can, but we don't routinely do them. And the second reason is this. I have a lot of experience with contrast in the intrathecal space because I've been around a long time. I come from an era when myelograms were frequently done, and we would get CTs of the brain after contrast was given intrathecally. So I know what it looks like, and this is what it looks like. Younger people would not have as much experience as I do.
Did you write a report?
No,
You're aware that on June 9, 2022, Arlina Addison walked into the pain clinic.
yes,
She was fully functional,
yes,
gainfully employed,
yes,
working 50 hours a week,
yes. I don't remember that amount, but sure.
independent,
Yes,
and she knew her granddaughter's names.
sure.
Okay. And she received a cervical epidural steroid injection from Dr. Yong S. Lee.
Yes,
That was around 10:30 that morning.
yes, you're correct.
And within 90 to 120 seconds of that injection, she seized.
My understanding is there was certainly some clinical sequelae, yes.
She exhibited decerebrate posturing.
Again, as you know, that's been contested, but I know she displayed symptoms, yes.
Well, you read the record. I thought you testified under oath earlier, right?
No, I actually did read that record, but I didn't read the Wellstar records. But you know, this is not my area. This is clinical.
Well, that's why, I mean, you defer to a physician and a nurse who were there and both documented decerebrate posturing, right?
Well, it's certainly not my area. Let me put it that way. So I would defer to clinical people, yes.
So you understand that she exhibited decerebrate posturing.
Well, Mr. Potts, I already told you that I know that's been contested, but it's not my area. I'm not going to be discussing this in terms of a jury or anything.
What exhibit is this, Madam Court Reporter?
If you make the excerpts of Dr. Otistat's number 4, then the next one will be 5.
Okay. Exhibit number 5.
Dr. Zay, if you're sharing your screen, I don't know who's got it up, but you'll need to take
You
that
need
down.
to take that down.
There you go.
This is, now you've reviewed this record, haven't you, Dr. Say?
This is the injection, yes.
Yes, sir. This is the OrthoAtlanta medical record for, do you see that, Arlina Addison for June 9, 2022?
Yes.
You can see when I highlight that, right?
Yes, I can.
Okay. And do you see here, do you recall that Miranda Dudley was one of the nurses?
Yes, I do.
And Miranda Dudley documented that her patient, which she observed, exhibited decerebrate posturing. Do you see that?
Yes.
Any reason to disagree with the registered nurse who was there and observed the decerebrate posturing?
Not for me. I'm a neuroradiologist. This is a clinical issue.
Right. And you agree you have to, I mean, your job is to interpret films, right?
Yes.
CTs,
MRs, sure.
CTs, MRIs, CTAs, right?
Sure. Yes.
And a clinician has to correlate those clinically, right?
Yes.
That's not your job, right?
We do clinical correlations, but for the purposes of what we'll be discussing here in a medical legal case, you are correct. I will not be going into clinical.
Right. And you don't follow patients in your office. You don't have clinic, and that's not your type of work, right?
Yes, correct.
So in addition to Nurse Dudley documenting decerebrate posturing, if we scroll down to Dr. Lee, he's got a clinical note here you read as well, right?
Yes, again, I'm happy to discuss this, but it's not really my area of expertise, not something I would be discussing in front of a jury.
Yes, sir. Then you read here where Dr. Lee also described what he exhibited based on his education, training, and experience as a physician, a board certified physician, as decerebral posturing. Do you see that?
Yes, I do.
Okay. And not only did he document decerebral posturing, he also described it in the parenthetical here, right?
Yes.
Arms upward, fist clenched, back arched, legs straight, feet and toes down going. Do you see that?
Correct.
And you agree that's decerebral posturing, right?
Not my area, not something I'll be discussing, but it sounds like it to me, yes.
So, yeah, I mean, there's no reason other than to benefit defense lawyers to try to change this physician's medical record, is there?
Object to form, argumentative.
You may answer.
I have no comment on the decerebral posturing. It's not my area of expertise.
What do you mean, no comment on it?
I have no opinion on it. It's not my area of expertise.
Okay, well, you understand that she exhibited decerebral posturing after 90 to 120 seconds after the injection, right?
That is in the records, yes. Again, not my area of expertise, not something I would be discussing.
Okay. But that's part of what you call a history, right?
Yes, it is, but my opinions are based on the films.
Your opinion what?
My opinions are based on the films.
Okay. But her history here is decerebral posturing within 90 to 120 seconds of the injection, right?
Yes, you read that correctly.
All right. And then you're also aware that she lost control of her bladder,
Yes, I am aware of that.
urinated on herself,
Yes, I'm aware of that.
unable to speak,
Yes,
unable to follow commands,
yes,
entire side of her face, facial droop,
yes.
all documented by a physician, right?
Yeah,
And by the nurses who also observed it, right?
I believe so.
Okay. And both were there, you weren't, right?
Yes.
We look at Exhibit 5, we also see, I'll put this back up. She was taken to the emergency department.
Yes,
And when she got to the hospital, they performed CTs, right?
yes,
MRIs, right? I couldn't hear you.
yes,
And CTAs, is that right? Yes.
yes.
Yeah, you can't, it's hard for her to take down a head nod. So if you don't mind, and I may remind you along the way.
I actually am responding, but I think it's because maybe I'm, only one of us can speak, but I actually have responded.
All right. If I cut you off or interrupted so you couldn't speak, I apologize, and you just let me know when that happens. All right.
Thank you.
So, and the CTs, both the CT before and after, read SAH, right? Subarachnoid hemorrhage,
That is in the official report, yes.
and it's bleeding in the brain, right?
Well, it's bleeding outside the brain, but inside the skull, yes.
Right, and you agree the skull is a confined space, right?
Yes,
And you're familiar with something called cerebral perfusion pressure?
yes,
Okay. And you're also familiar with something called intracranial pressure?
sure.
And there's not a lot of extra space in your brain, right? In your skull.
Unfortunately, it depends a little bit on how old you are, but I understand what you're saying, and the answer is yes.
Okay. The tolerances are quite small.
The tolerance,
There's not room for to pack luggage in your skull, right?
true.
Okay. And you agree that she did have blood in her skull, right?
What I see is essentially contrast.
Okay.
Rule out a little bit of blood, but what I see is essentially contrast.
And you agree that she also had air in her skull?
Yes.
And that's pneumocephalus, right?
Yes.
So you're saying she didn't have blood and air in her subarachnoid space. She had contrast in air. Is that right?
Primarily contrast and air. There certainly could have been a little blood, but it's primarily contrast.
Okay. And the only reason that the only way air and contrast, if any, could have gotten there would be a breach of the dura, right?
Yes.
It's because Dr. Lee injected her in her cerebrospinal fluid, right?
Yes.
Okay. And you're also aware of follow-up CTs, is that right?
Yes, sure.
And you believe Arlina to be some sort of fake or fraud?
No, I have no opinion on that. I'm only going to comment on the imaging studies.
Okay. And you weren't aware before today that Dr. Harper, another defense expert employed by Dr. Bomar, testified that there was no contrast on the June 9, 2022 film, right?
Objection form misrepresents testimony.
You may answer.
We've gone over this already. You asked me before, and we went over this at length. And yes, you are correct. I was not aware of Dr. Harper's testimony.
Okay. Now, you didn't perform any of the scans that we're talking about, right?
Correct.
None of the CTs and none of the MRIs? You didn't write any of the reports, is that right?
Correct.
You reviewed it later
Correct.
on behalf of Mag Mutual?
Oh, I didn't know that was the company, but I guess it is.
On behalf of Mr. Bomar, the defense
Yeah.
lawyers?
Yes.
If you need to take a break, just let me know.
No, I'm fine. Thanks. I'm fine.
All right. I'm going to show you what's been previously marked as Exhibit 6.
Oh, yeah.
Hey, I'll show you. I'm sorry.
Go ahead. I see that.
Yeah, I'll show you what's been previously marked as Exhibit 6, which are a number of film excerpts. You've reviewed these, right?
Yes.
You see here, number 6, it's 1, 2, 3 deep and 1, 2, 1, 2, 3, 4 across, right?
Yes.
We're going to scroll through these. And I'm looking at the upper left corner. And this is, do you see where it says image 12/41?
Yes.
That's image 12 of 41, right?
Yes.
And you see up in the upper right, it says Arlina Addison.
Yes.
And do you see in the lower right, it says 6/9/2022. That's the date of this film, right?
Yes.
And you see where it says 2:08:44. That's the time of this film, is it not?
Yes.
Okay.
Yes.
And when we're looking at, so these are CT head images for Arlina Addison on June 9, 2022, right?
Yes.
And if we scroll on over, they go to June 13. Do you see that?
Yes.
You've reviewed all these, right?
Yes, I did.
And the one over on the left, and this is a non-contrast CT, right?
Yes.
And do you see that? So there's no intravenous contrast, right?
Yes.
No omnipaque, right?
There's omnipaque, but there's no intravenous contrast.
Okay, you're saying there's omnipaque in this film.
Yes, there is.
Under oath. That's your testimony. Yep.
Yes, we've gone through this before, but yes.
Okay, so you disagree with Dr. Harper's under oath testimony about the omnipaque. Is that right?
Yes, but I'm a neuroradiologist, and not only that, as I mentioned before, I have experience with this because I come from an era when myelograms were quite common, and this is what CT scans after myelograms looked like when there was contrast in the intrathecal space.
All right. And these images were taken around 3 hours after she collapsed and exhibited decerebral posturing. Is that right?
Yes.
And you reviewed this series for pay. Is that right?
Yes.
Yeah. And that was by Mag Mutual, the insurance carrier?
Well, again, I didn't know that it was Mag Mutual, but we discussed that already.
And by Spencer Beaumar?
Yes.
And do you recall Miranda Dudley's deposition, the nurse that was also there?
Yes.
Okay. Then you recall her also saying no contrast was used. Is that right?
The form that represents the testimony.
You may answer.
That's not quite how I remember it, but
So how do you remember it, doctor?
we have to review the wording again. But I'm happy to if you want to show it to me.
Sure. So you don't remember as you sit here, is that right?
Yes.
Okay. Is this Exhibit 7, Madam Court Reporter?
That's correct.
Thank you. Can you see this all right?
Can you enlarge it a little bit?
Sure.
Okay, great. Thank you.
And this is Miranda Dudley testifying about the film, the same film we've talked about.
Yes.
And she was asked, can you see this okay?
Yes, I've read it.
Let me move this. This is page 178. Do you see that?
Yes.
And it reads here, you see no contrast dye in exhibit number 1. Do you see that?
Yes.
Best of my knowledge as a nurse, no. Do you see that?
Yes.
And again, she was there and you were not. Is that right?
Yes.
Okay. And you disagree with both Nurse Dudley and Dr. Harper then, is that right?
Back to form.
Yes, but I agree with Dr. Odestad.
Okay. Well, your testimony is Dr. Odestad testified he saw a contrast on the film.
Yes.
That's not what he tested. I disagree that that's what he testified to, but you agree. I mean, you believe that Dr. Odestad testified that there was contrast on the film, and you agree with him if he made that statement. Is that right?
Yes, and I will tell you that I don't see how you could interpret it any other way. He said, essentially, I see contrast.
It's fine. I mean, the jury will eventually decide that for us. So I'm looking, this is Dr. Lee's note. Do you remember that? Remember Dr. Lee?
Yes,
He performed the epidural steroid injection. Is that right?
yes.
And I want you to, can you see that all right on your screen?
Yes, I can.
And you see up here where he reads, you know, this is a detailed op note.
Well, it is a detailed op note, sure.
Well, I mean, I'm not making this up. Can you see the word detail, detail there?
Yes, I do.
Can you understand what detail means, right?
Sure.
What does detail mean, doctor?
A lot of detail, a lot of specifics.
Yes, sir. And what I want you to do is read this description in detail of what happened and show me where Dr. Lee, the one performing the procedure, indicated he used contrast.
Oh, I know that there's been confusion about this. And so I will, again, this is not my area. My area is the films. And I can tell you what the films show. But I'm happy to read this if you want, but it's not my area. It's not something I would be discussing in front of a jury.
Well, I mean, it's for you to give an opinion, you need to read the records, right?
No, actually, the films speak for themselves.
Okay. Have a look at that record, take your time and show me where Dr. Lee wrote in his detailed description of what he did that he used contrast.
No, I understand, and I understand this has been discussed in other depositions. So I realize it is not stated there specifically.
Okay. You agree that Dr. Lee, the physician that performed the cervical epidural steroid injection, in his detailed description, you see that? He never indicated that he used contrast. Is that right?
I'm sorry?
Could you read that back, please, Madam Court Reporter?
Question, okay, you agree that Dr. Lee, the physician that performed the cervical epidural steroid injection, in his detailed description, do you see that? He never indicated that he used contrast, is that right?
That is correct. I know that's been discussed in other depositions also.
All right, back to, I think it's Exhibit 6. Are the films Exhibit 6, Madam Court Reporter?
That's correct.
Thank you. So we're back. This is the top left corner, first film, image 12 of 41. Do you see that?
Yes,
And do you see where it reads A in the top and P in the
Yes.
bottom? Right?
Yes.
And that A stands for anterior
yes,
and P is posterior.
yes.
So an AP view is anterior to posterior.
No, anterior posterior is used for things like chest x-rays. This is just showing what's in front and what's in back.
Yeah. Anterior is in front, posterior is in back, right?
Yes,
And do you recall Dr. Lee referring to an AP view? Do you remember that?
yes, that's from the fluoro.
Yeah, and that's front to back, right?
Anterior posterior should be front to back technically.
Well, I mean, that's pretty basic stuff we're talking about right now, right?
Yes,
Okay, and the A on the top of this film is the anterior and the P is posterior, is that right?
yes,
That's front to back, right?
yes,
Even more basic, you see the R on one side and the left on the other?
yes, right and
Stands
left.
for- Go ahead.
Right and left.
Right. And do you see this green arrow here?
Yes,
And the green arrows, this is pointing to a hyperdense area. Do you see that?
yes,
And do you see the hyperdense area? See my arrow going around here? All of that is a hyperdense area, right?
yes,
And you can see it because the color is different. Is that right?
yes.
And that indicates blood in the subarachnoid space, right?
In this case, it's actually contrast.
Okay. Well, a hyperdensity like this is in a non-contrast CT is consistent with acute blood, right?
Can be, yes.
Okay.
Actually, to tell you the truth, acute blood, really recent blood, usually clots and doesn't look like this. This is usually a little older than acute.
Okay, so the board certified radiologist and neurologist who reported on these films on June 9, 2022 and after at Wellstar, they're all wrong, right?
Well, I know a lot more about the case.
Sir, I want an answer to my question, then you can talk as long as you want.
You are correct. He is wrong.
Well, they're all wrong. There was more than one, right? You remember that?
Yes.
Okay, and they're all wrong, and you're right. Is that right?
I am right because I know a lot more about the case than they did. Your average CT radiologist reading a CT would never think that contrast had been injected in a case like this from an epidural steroid injection.
You'd agree that the distribution, especially along the sulci, you know what a sulci is?
Yes.
Okay. And that's a groove or fold on the brain surface, right?
Yes.
And cisterns, those are reservoirs at the base of the brain, right?
Yes.
And you agree that the distribution in the sulci on the brain surface, that tracks with an SAH, right?
Well, we've discussed this. I think it is contrast.
Sir, that's not an answer to my question.
Okay, let me
Can you
answer.
hear me okay? I've
Let-
never been accused of being too sotto voce, but Madam Court Reporter, would you read back my question, please, ma'am?
Question, and you agree that a distribution in the sulci on the brain surface, that tracks with an SAH, right?
Yes, it could.
And that's what we have here, right?
Yes, but in this case, I think it's contrast.
Okay. And the reason that matters, when blood collects in the sulci, and the sulci, I put my arrow right on them. See that white line right there? Because the jury is going to get to see this. See that white line? That's the sulci, right?
Yes.
And you see that white line? That's tracking the sulci, right?
Yes, it's actually sulci.
Sulci. And the sulci right here where my arrow is, you see
Yes.
that?
Yes, you are correct.
And it's tracking the sulci right here where my arrow is, right? See that? You agree with that, right?
Yes.
And the black, what is that? That's air, right?
No, that's actually probably CSF there.
That's what?
Cerebral spinal fluid. That's not air, but there is air. It's further down.
Got it. So everywhere my arrow is here, this is still, this is where blood is collected in the sulci, right?
We've discussed this. I think it's contrast.
Okay. We'll talk about that. These are all this in this entire, you see that R in this entire right side, all that lighter color. You see all that? That's all hyperdense, right?
Yes.
Okay. And do you agree that when blood collects in the sulci, it's a red flag for subarachnoid hemorrhage?
Yes.
Okay. And that's what we see here, right?
It is wise to think of subarachnoid hemorrhage. In this case, it's contrast. We've gone over this a lot.
Okay. We'll get to that part too. You agree that blood tracks the grooves, gravity pulls it there, right?
Yes.
Blood in the sulci means it's in the wrong place and it got there from trauma or break, right?
Or an aneurysm, yes.
Blood, and you agree here that this is indicative of blood in the sulci, the grooves of the brain, right?
It's wise to suggest that's a possibility. In this case, it's contrast.
Okay. And then the cisterns, the deep CSF spaces too, is that right?
Yes.
Okay. And those aren't incidental. I mean, those are hallmarks of a subarachnoid hemorrhage, right?
They can be, yes.
Okay. And you agree that normal CTs don't rule out a severe brain injury?
Yes, that's possible.
Okay. You agree that normal CTs don't rule out severe cognitive impairment?
Yes, that's possible.
You agree that normal MRIs don't rule out severe brain injury?
Well, it depends what you're talking about. But certainly MR is not a microscopic technique, so we cannot see microscopic damage.
Right. So you agree that normal MRIs do not rule out severe brain injury, right?
It depends on what you're talking about.
Sir, it's a pretty straightforward question.
Finish.
Sir,
Depends what you're talking about. You can give it as a blanket statement.
I can barely hear you.
Oh, really? You can give it as a blanket statement.
That's
It depends
better.
what you're talking about.
What is that?
It depends what you're talking about.
Well, you agree that a normal MRI does not rule out a severe brain injury?
It's very good. It's very sensitive. And you have to look at the specific condition that you're talking about.
All right, so I want you to cite for me anywhere in the history of medicine, any treatise, any textbook, any chapter in a textbook, any peer-reviewed article, any non-peer-reviewed article, any grand rounds, throwaways, anything that would disagree with my question, that a normal MRI does not rule out severe brain injury. Cite for me anything.
Well, it depends. I didn't say that it doesn't rule it out. I said it depends what you're talking about.
Okay. So you can cite for me no published literature. Is that right?
Offhand, with respect to your exact question, you are correct.
Okay. And you agree that a normal MRI does not rule out severe cognitive impairment, right?
It is possible.
Yes, sir. And the same for the severe brain injury, normal MRI.
It depends what you're talking about. It is possible.
I'm moving on to, this is still exhibit, I believe, 6. If we move over from, I guess, left to right, I guess it's left to right for both of us, right?
Yes.
Okay. The still on the top row on the second column. And
Yeah.
you see this is image 10 of 41. You see
Yep. Yes.
this is still Arlina Addison. Do you see that in the upper right corner?
Yes.
You see this in the lower right corner. This is 6/9/2022, now 10:25 p.m. Is that right?
Yes.
And so this is about 8.5 hours later. Is that right?
Yes.
And you see, if you compare the two top, the two images on the far left and the one adjacent to it on the top row, these green arrows point to the same area of the brain. Is that right?
Yes.
And you see that in this second image at 10 o'clock at night, and these are both axial images. Is that right?
Yes.
Okay. And the green arrow shows what appears to be an acute hemorrhage in the right frontal lobe. Is that right?
We've discussed this. We can discuss it over and over and over again. I believe it's contrast. I understand you want to say it's blood. There is some brightness that's gone down.
The what?
There is some brightness that has gone down.
Brightness that has gone down. So your testimony under oath is in this image number 10 out of 41. Is it, quote, brightness has gone down?
Yes, I mean, it's
Contrast?
not as bright as on the left-hand image.
Okay. Now, you don't dispute that the radiologist of record diagnosed subarachnoid hemorrhage, right?
Correct.
Okay. And the pneumocephalus, I want to talk to you about the air. Do you see the hypodense or black pockets in the cranial vault?
Yes, not on this image, but on other images, sure.
Right. I'm looking over now, image 10 over 38. Do you see air there?
No, that's not air, that's fluid. But if you go down, there's probably still some.
No. Okay. But first of all, on this image, this is now 6:10 at 3:33 in the afternoon. Still on the top row, the third image from the left. This is still the same right area. Is that right?
Yes,
And you see where these three arrows are showing the same area. And you agree that the second image on the top row, that's not normal, right?
yes.
And the third image also not normal, right?
More normal, probably still a trace.
There's still a trace of blood.
We've discussed this. You can call it blood. If I'm going to agree with you, you can call it blood. I'm going to call it contrast.
Okay. And then over on the still the top row, do you see the fourth image? You see the green arrow still on the right side. This is now 6:13. This is 4 days later, right?
Yes.
And do you see this is still not a normal CT, right?
Well, actually, to tell you the truth, it's pretty close to normal at this point.
Okay. So and just because this image has improved does not mean the brain injury on June 9th just disappeared. Is that right?
Back to form.
That is possible, yes.
Okay.
I don't see anything here, but yes, it's possible.
And none of these four images on the top row from left to right are normal. Is that right?
Well, you asked me already. I think the one on the far right is actually pretty close to normal.
You answered that question. My question is a little different. It's not normal, right?
No, actually, I think that this scan is probably normal.
Okay. And if we go down to the third row, you see that still on exhibit 6?
Yes,
You see the green arrow?
yes.
And do you see this? What is that?
You call it blood, I call it contrast.
Okay. And that, what I call blood, you call contrast, goes from do you see that cross where it covers up what, roughly half the brain?
You mean what you're circling?
Yes.
Yes, I see that.
And you agree with that, right?
Yes.
So I'm going to use my cursor. We're going to go around and I'm going to go, do you see it here?
Yes.
Okay. And we go around and then down and then across. That's roughly the size of what I'm calling blood and you're calling contrast. Is that right?
Yes, this is basically the same as what we have been talking about for the axial scans. It's the same thing. It's just a different plane.
It's a different view though, right?
Yes, a different plane.
Well, the first was an axial view. Is that right?
Yes, this is a sagittal view.
Okay. And then if we look at the second image, same thing here. I mean, this is blood for, I mean, the majority of the brain from this view. Is that right?
Well, you call it blood, I call it contrast, but yes.
And it again goes, all the way around the top, down to below half. Is that right?
Sure.
Or lower than that? Is it, where would the line of demarcation be, if there is one? In here?
There's probably a little all over, but
Okay.
it's gone down substantially since the first scan.
But this first scan, still on the third row, but the column, do you see, this is the same white in the sulci, is that right? You see that?
Oh, yes, it is.
Okay. And that's the same, and all of these where I'm indicating that white, those are sulci, right?
Yes.
And that's where blood would be in a subarachnoid hemorrhage, right?
Yes.
And that would cause it to appear like this, right?
Yes, not in this case, but yes.
Then what is this where I'm marking right here?
That's called the torcula,
Okay.
or actually that's a sinus, the transverse sinus.
Then if we look at the third image, there's still what I call blood and what you call contrast here as well. Is that right?
There may be a touch, yes.
A touch. You're saying it's now, and this is now June 10th at 3:33 in the afternoon. Is that right?
Yes.
And it's where? Here?
No, but you can see that it's much less obvious than before. So there may be a little bit still in the cell side, but it's much less than before.
Okay. And your testimony is in the soul side. That's not, it's there, but it's contrast, not blood. Is that right?
Yes, I think we've gone over this a million times, but yes.
And whenever we talk about contrast, of course, they hadn't administered it at the hospital. That would have gotten there because Dr. Lee injected Arlina Addison on June 9, 2022, around 10:30 in the morning into her cerebrospinal fluid, right?
Yes.
Then we going over to, this is still the third row and the fourth column. And this is now 4 days later, June 13, 2022, 12:59. There's still what I call blood, what you call contrast is still there. Is that right?
Well, we discussed this already. As I said, I think this is actually pretty close to normal.
Close to normal, but not normal.
Well, I think it is normal.
Okay, so you see no blood or contrast here.
Yes, on this particular slice, that is correct.
You see none.
I don't see anything that's really clear to be either blood or contrast.
Okay. Now, you also, you agree that there was air in the hypodents or black pockets within the cranial vault
Yes.
in each of the CTs?
Well, not eventually, the air gets resorbed, but yes, in the beginning, sure.
Okay. And you agree that that's called pneumocephalus, is that right?
Yes.
And you agree pneumocephalus does not occur spontaneously in a healthy individual?
Yes.
It requires a pathway.
Yes.
And in this case, the cervical epidural steroid injection, that was the pathway
Yes.
injected into the cerebrospinal fluid, right?
Yes.
Now you've testified this could be contrast, not blood, but you agree this was a non-contrast scan, the one we just looked at, right?
Yes.
And you didn't know before today that Dr. Harper testified that there was no contrast in that film. Is that right?
The form.
You've asked me already, and I agree. We've discussed this.
Okay. You agree that every trained radiologist knows that CTs can measure density?
Yes.
Okay. And that's the Hounsfield units we were talking about, right? Right?
Yes.
And you didn't use that when you reviewed these films, is that right?
Correct.
And you agree that acute blood ranges from 30 to 45?
Yes, roughly.
And IV contrast often measures over 80 up to 300?
It depends whether or not it's dilute.
But it would be over 80 to 300, roughly.
No, if it's dilute, it doesn't measure that much. It looks like blood.
Ah, okay. And you're sure this is contrast just because of your experience, right?
Yes, I feel this is contrast. It
And
behaves.
I looked at your CV. I think that was number 1. I didn't see any articles in here regarding cervical epidural steroid injections. You agree there are none?
I agree.
And there are no articles regarding mistaking blood for contrast?
Correct.
Or mistaking contrast for blood?
Correct.
Nothing on your CV about cervical epidural steroid injections?
Correct.
Nothing in here about decerebrate posturing?
Yes, you asked me already, and the answer is you're correct.
You're aware that Arlina collapsed 90 seconds after the injection? Is that right?
You asked me already, and I said yes.
And her symptoms included not just decerebrate posturing, but also incontinence, inability to communicate, inability to follow commands, and a full-sided facial droop, right?
Yes, you asked me already, and I said yes.
And you've never cared for a patient, I mean, physically, taken a history, done a physical exam, and cared for a patient like that. Is that right?
Object to form, asked and answered.
You may answer.
After epidural steroid injection, that is correct, yes.
You agree that her CT, Arlina Addison CT, taken some 3 hours after she exhibited the decerebrate posturing, the seizure, the incontinence, inability to communicate, inability to follow commands, and the entire side facial droop, that her CT was consistent with the kind of injury she had, right?
Object to form.
You know, I'm surprised, but it's really not my area. I will defer to the clinical people.
Okay. The radiologists that performed the CTs, they all agreed that it was a subarachnoid hemorrhage, right?
You asked me already, and I said yes.
And subarachnoid hemorrhage is blood, not contrast, right?
Yes.
And there's nothing in any of the reports that you've read so far that say anything like uncertain, right?
You asked me already, and I said yes.
And nothing that says anything remotely akin to possible contrast, right?
I'm sorry?
There's nothing in any of the reports that you've read that says anything remotely akin to possible contrast. Is that right?
You asked me already, and I said yes.
They each say blood and subarachnoid hemorrhage, right?
Yes, you asked me already, and I said yes.
And you reviewed the subsequent CTs and MRIs for Miss Addison?
Yes.
And you said they appeared normal?
Yes.
I think you said by the 13th, 4 days later, they appeared normal. Is that right?
Yes, that's my memory.
And you agree that a normal scan does not mean a normal brain, right?
For CT, that is true.
Okay. And well, same for MRI.
Less likely for MRI, but I would not say it's impossible, yes.
Okay. Less likely, but same for MRI, right?
Less likely, yes.
I mean, and a patient can have devastating symptoms and still have a clean scan, right?
Asked and answered.
Sir, you're not the lawyer. Answer my question.
I discussed this.
Don't do that again.
I discussed this already, and I told you that it really depends on what you're talking about. We went over this already.
You can have a devastating symptoms, and still have a clean scan, right?
It depends what type of injury you're talking about, but it is possible, yes.
Okay. You can have a severe brain injury and still have a clean scan.
Again, you asked me this before, and we went over this quite at length. I said it depends what kind of injury you're talking about, but it is possible, yes.
And you agree that you could have a severe cognitive impairment and still have a clean scan, right?
You asked me this before, and I said yes.
It happens in trauma, right?
That's controversial.
It happens in stroke.
A clean MR scan?
Yep.
That's unlikely.
Okay. It happens every day.
It's very unlikely.
You're saying that there aren't patients that have a clean scan with a severe brain injury and a severe cognitive impairment every day. Is that right?
It's not what I said. I said You asked me this already. It is possible.
Okay. Just because the scan looks okay, it doesn't rule out a severe brain injury, right?
You've asked me this already, and I have responded already.
Well, I'd like a response.
Do I have to repeat myself constantly?
Yeah, we want to make sure we have a clean record for the jury.
I think we have a clean record because you've asked me.
Sir, I want an answer to my question.
Please don't interrupt me.
No, sir, I want an answer to my question. Objection moved to strike is non-responsive. I need an answer to my question.
It depends what kind of injury you're talking about. This is at least the 7th or 8th time I've answered this question.
And I believe you've already testified when we were looking at those scans from left to right, you saw how they went from bad to not so bad to normal. Is that right?
Yes, again, I would have to refresh my memory on the 13th before saying normal, but what you showed me was normal.
Okay. But you already testified under oath that what we were looking at, and it was on the screen for the jurors and for people that are going to watch this online, that you said that was normal, the 4th image, right?
Yes, the image you showed me was normal, I thought.
And you agree that when you have an insult like Arlina Addison had, that just because the blood or, in your view, contrast dissipates or is resorbed, doesn't mean the injury goes away, right?
It depends what you're talking about, but it is possible, yes.
Okay. And I want you to cite for me any treatise, textbook, chapter in a textbook, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaway, anything in the history of medicine that suggests that just because over the course of, say, 4 days, the scan improves to something that you testified under oath is normal, that the initial insult, the injury from the initial insult just goes away.
I cannot cite that to you.
Okay. Are you aware of any literature that suggests such a thing?
No.
Okay. It's because there's not any, right?
It depends what you're talking about, but yes, you are correct. I mean, this is a very broad statement.
I want to show you what's been marked as exhibit, I don't know, 8 or 9 or
Number 8.
9. Thank you.
8.
8. Thank you. This is an excerpt from Arlina Addison's medical record. I believe this first one would be the CT report that you actually have reviewed. Is that right?
Yes.
And I've used this same exhibit. This is more than one CT and more than one and an MRI. Were you aware of that before now?
I'm sorry, I didn't understand your question.
Sure. We're looking at, do you see here where it reads CT head without IV contrast?
Yes.
Okay. And then we scroll on down, we've got a CT angiogram, neck and head with IV contrast.
Oh, yes, I'm aware of that.
Okay. And so you read that report as well. Is that right?
No, that report I did not have.
Okay. And then there's CTA of the neck, and it goes on to read, and there's an MRI of the cervical spine without IV contrast. Did you read that as well?
I read the scans. I read all the scans. I did not read this report.
Okay. The only report you read was the one at the very top, the first one. Is that right?
Yes.
Okay. And it reads, and this is, again, Arlina Addison. This is June 9, 2022. This is a CT head without IV contrast. Clinical indication, CVA symptoms, aphasia. What is aphasia?
Inability to talk.
Inability to communicate. You agree with that?
Yes.
Loss of consciousness and decerebrate posturing after outpatient procedure for cervical spine. Outpatient procedure for cervical spine would include a cervical epidural steroid injection.
Yes.
And findings, there's diffuse trace subarachnoid hemorrhage. Do you see that?
Yes.
And subarachnoid hemorrhage is by definition blood, right?
Yes.
Most pronounced in the right frontal region. Is that right?
Yes.
That would be in this part of the brain.
Yes.
But it was really everywhere in the scans that we looked at earlier, right?
Used. Yes.
Initially.
Yes.
4 days later, it had, for the most part, cleared up in your view, right?
Yes.
Most pronounced in the right frontal region and multiple foci of air in the subarachnoid space, primarily adjacent to the anterior right frontal lobe, anterior falx, and the skull base. You see that?
Yes.
And you would agree with that as well?
Yes. I don't agree it's blood, as we've discussed at length, but I do agree with the findings of the error. Yes.
Okay, you agree with the findings, in your view, what you would substitute in this CT, CTA, and MRI contrast for blood. That's only difference, right? So I couldn't hear it. It goes on to read the ventricles are normal in size, position, and configuration. There is no midline shift. You see that?
Yes.
Down here, impression, diffuse subarachnoid hemorrhage and foci of free air in the extra-axial spaces. Recommend a CT angiogram of the head to evaluate for possible aneurysm. You agree the CTA ruled out an aneurysm, right?
I don't see one.
The CTA ruled it out, right?
Well, CTAs don't always rule out aneurysms, but I don't see one.
Okay, when you reviewed the films, so you ruled it out when you reviewed the films?
I ruled it out for radiology purposes, yes.
Okay. And you did that using the CTA, right?
Yes.
Okay. Given the symptoms begin during a spine procedure, you agree with that?
Yes.
Recommend MRI of the spine to evaluate for possible hemorrhage. And CT angiogram, neck and head with IB contrast. Here again, subarachnoid hemorrhage, status post-cervical spine procedure. And this is, you see the same thing, except you think it's contrast, not blood, right?
Yes.
Go on to read head and neck. This is a CTA of the neck. There is diffuse trace subarachnoid hemorrhage and multiple foci of intracranial air, most pronounced adjacent to the frontal lobes and along the anterior falx. No hydrocephalus, is that right?
Yes.
What is hydrocephalus?
Swelling of the ventricles.
And you agree with these findings, with the exception that you think what they're describing as blood is a contrast, right?
Yes.
Omnipeg dye administered by Dr. Lee and the outpatient cervical epidural steroid injection. Yeah. Goes on to read, now we're at page 38. There's diffuse trace subarachnoid hemorrhage and intracranial air, likely related to recent procedure. Correlate clinically. That's what we were talking about earlier, right?
Yes.
And based on what you read in the outpatient procedure record, you would correlate that clinically to what was found in the CTA and the MRI, right?
Yes.
With the exception that what they describe as blood, you would describe as contrast. Is that right?
Yes.
History, subarachnoid hemorrhage, status post-cervical spine procedure, you agree with that?
Yes. Well, I don't think it's hemorrhage, but yes.
Well, yeah, but if you were taking a history, you would have written the same thing, except you believe it's contrast, not blood, right?
Yes.
MRI spine without IV contrast. Again, foci of air and the intrathecal thoracic spine. And the thoracic spine is from the base of the neck, from the base of the cervical spine, right?
It's the back, yes.
Well, upper back, right? And you would intrathecal thoracic spine and prepontine cistern, similar to CT, no epidural collection. Is that right? You agree there was air in the spinal column, right?
Yes.
And that also was a result of the cervical epidural steroid injection. Is that right?
Yes.
Compression, scattered foci of air within the subarachnoid space, similar to recent CT, no extra axial fluid collection. This is, forgot to mention the time. This is 2:47 in the afternoon, is that right?
Yes.
Arlina Addison, principal problem, subarachnoid hemorrhage, CT at 8 p.m. and CT and AM per NR, that's neurosurgery, right?
Yes.
And there was a follow-up on the 610 and 629, peripheral vision loss in the right eye. What would cause peripheral vision loss in the right eye?
I will defer to the clinical people.
Okay. You agree that dye and blood behave differently?
A little bit, yes.
Oh, hold on. You agree that the MRI confirms that air traveled up the spine into the brain?
Yes.
And you could tell that from the air in the intrathecal thoracic spine and prepontine cistern, right?
And in the brain, sure. Or around the brain, sure.
You agree that it's important to differentiate blood from contrast in your position as a radiologist, right?
The best we can, yes.
And you agree that blood follows gravity
Yes.
and contrast disperses,
Well, contrast follows gravity also.
like blood?
Yes.
Okay, cite for me any treatise, textbook, chapter in the textbook, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaways, anything in the history of medicine that suggests they behave the same.
Well, that they both settle down in compared to CSF, yes. I mean, this is easy to find.
Okay, can you point me to any literature?
I would think that if you just look up any sort of basic textbook of imaging, we'll talk about that, about
You
contrast.
agree? I apologize. You agree that blood changes in density over time?
Yes.
Okay. And contrast washes out?
Yes.
You agree that your testimony still the radiologists were all wrong in this case, right?
You asked me already and I said yes. I know a lot more about the case than they did.
Than they do?
Than they did, yes, at the time.
I want to show you what has been previously marked as, I believe it's Exhibit 9.
Yeah.
And what you said, you know more than the treating physicians that were there at the time. And how's that?
With respect to whether it's blood or contrast.
And you know that better than they do because of what?
Because I'm looking at it retrospectively, because they were probably not aware that there was a breach in the epidural space in this procedure. And also because they probably were not aware whether or not contrast was used. And also because of the way the films look. As I said, I have experience because I come from an era when myelograms were more common, but I went into that before.
But you haven't spoken with them, right?
No, I have not spoken with them.
show you what's been previously marked as exhibit. Which one is this, Madam Court Reporter?
This will be 9.
Thank you. And how much contrast do you believe was injected into Arlina's cerebrospinal fluid?
According to the testimony, was 3 millimeters, 3 milliliters that was given in contrast, some of which or all of which may have gone into the subarachnoid space.
I'm going to show you what's been marked as Exhibit 9. Can you see that all right?
Yes.
And first of all, do you recall what time Arlina Addison's procedure was completed?
Yes, 10:34.
Okay, and if we look at this film, it's 6/9/2022. Do you see the time here?
Yes, 9:59 a.m.
You agree 9:59 a.m. comes before 10:30 a.m.?
Yes.
So how do you know this was Arlina Addison?
I have no explanation for why the time is wrong. I have no idea.
So you don't know whether this was Arlina Addison, right?
Well, I would assume it is because it's very difficult to have this reproduced with this injection. I would assume it is.
I think you testified earlier that you use these machines, right?
Yes.
So then you're aware that this date and time is internal, right?
I'm not aware of what they have, but I am aware of reading the testimony. So I would have to say that basically nurse, what's her name?
Dudley.
Oh, yes. Dudley said she did not adjust it. So yes.
Objection moved to strike is non-responsive. Would you read back my question, please, Madam Court Reporter?
Question, so then you're aware that this date and time is internal, right?
I have no knowledge of this, so I don't know. I can only read the testimony where it seems that that was the case.
Yeah, I mean, the testimony is that nobody adjusts these times. These are internal, right?
Yes.
The machine time. And there's also testimony that they have folks come out and ensure these are operating at least once a month. You recall that?
Yes.
They also, do you recall the policies and procedures requiring the nurses to confirm that this is accurate before the procedure begins, that everything's operating accurately? Do you recall that?
I do not remember reading that, but it's very possible.
What's very possible?
That's in the procedures, but I don't read that.
So I'd like for you to explain to me that if her procedure ended at 10:30 and 9:59 comes before 10:30, how this can be her fluoroscopy image.
I do not have an answer for that.
Okay. And did you also determine whether her injection was at C6-7 or C7-T1?
Yes.
And this injection is at C7-T1, right?
Yes, you're correct.
Okay. And also, if you looked at Dr. Lee's note, we can go back to it if you like, but he said C6-7, right?
That is in the records, yes.
His medical record, well, throughout the medical record, it says cervical epidural steroid injection at C6-7, right?
Yes.
So not only is the time wrong, the level of the injection is also wrong, right?
It does not correlate. That is correct.
So the only thing that correlates is Arlina Addison up in upper left corner, right?
Well, actually, that's not true because her films correlate. In other words, when I look at this film and look at other films that are known to be Arlina's, they do correlate. So this is Arlina, but I do admit to you that the time I cannot explain.
So you've compared the films, and comparing the films, you've assured yourself that this is a film of Arlina Addison. Is that right?
Yes, because she had some subsequent films and I can compare them.
Okay. And show me in this film where there's contrast, if any.
Sure. It's what everybody's talking about, including Dr. Odelstad, and it's right above the needle tip.
Right above the needle tip is right here, right?
No, that's the hub, the other end.
Okay. So show me where the contrast is.
That triangular thing right above the tip.
Okay, right here.
Exactly. I can't really see yeah, there it goes. Right. That's it.
So I want you to tell me if I'm doing anything inaccurate, but your testimony is this shadow right here is a needle tip. Is the contrast? Is that right?
Yes, but I agree with what Dr. Odelstad said.
Okay. And you think that's enough contrast? Is that right?
Yes, for purposes of trying to figure out things, yes, that's it.
And what does that, what you call the triangle of contrast, indicate to you?
Well, that the contrast was used because there is contrast here.
Yeah, but what does it indicate about where the needle is?
Well, it's right above the needle.
Or what does it indicate about whether the needle is in the cerebrospinal fluid?
Oh, it's not in the cerebrospinal fluid.
Then what you testified earlier that the contrast was in the cerebrospinal fluid.
Yes, this contrast is not in the cerebrospinal fluid. There is contrast in the cerebrospinal fluid. I agree basically with what Dr. Odelstad said.
So this contrast is different from the contrast in the brain, is that right?
No, I agree with what Dr. Odelstad said, that this was injected and then probably the needle was advanced and more contrast was injected.
Okay. And so you're saying that what Dr. Odelstad testified to is accurate?
With respect to this, yes, I agree with what he said with respect to the contrast.
Okay. And it's your testimony that he said this was contrast, not that if it was contrast, it wasn't enough. Is that right?
Yes. Yes, that's my memory.
All right. Any contrast other than this triangle right here?
No.
Okay. And this is adequate contrast to indicate in this case that he's not in the cerebrospinal fluid. Is that right?
This is not in the cerebrospinal fluid. That is correct.
So your testimony is that Dr. Lee injected the contrast, and then after injecting the contrast, he pushed the needle into the cerebrospinal fluid. Is that right?
Well, I'm not sure if he pushed the needle into the cerebrospinal fluid, but somehow the needle tip entered the cerebrospinal fluid, yes, or caused a nick.
And that he was still injecting contrast at that time?
Probably, yes.
Isn't the purpose of contrast to find out where the needle is?
Yes.
And aren't you required to find out where the needle is before you inject drugs and saline?
Medications, sure, yes.
And so you wouldn't still be injecting contrast when you're injecting drugs, is that right?
Yes. As a rule.
Don't inject, I apologize, go ahead.
As a rule, yes.
Yeah, well, I mean, you don't inject contrast and drugs at the same time, right?
As a rule, yes.
Okay, well, in this procedure, that is the rule, right?
Yes.
You inject the contrast first to see where you are, right?
Yes.
And once you confirm where you are, then you don't inject any more contrast, you inject the drugs, right?
Yes.
Just going to object to the floor to the extent he doesn't qualify to talk about this procedure because he doesn't perform it.
And so at that point, you wouldn't still be injecting contrast, right?
That would be my understanding, but you know, that's an excellent point. I don't do these procedures.
I object to the speaking objections. Madam Porter, can I get the time for that objection? I mean, if you have it.
One,
If not, stamp, I need that part, I need that stamped with the time, please.
I'll do that.
Thank you. So I think we were talking, you inject the contrast and the drug separately, right?
That's my understanding of how the procedure is done, yes.
Right. Did you bill Medicare?
Do I? No, the hospital does.
Did you bill Medicaid?
No, the hospital takes care of all the billing.
Okay. Well, Medicare, Medicaid are billed for your services, right?
Yes,
And you agree that Medicare and Medicaid have rules that you're required to follow?
I assume so. This is not my area of expertise, but I assume so.
Okay. You agree that it's important. I mean, you don't submit a bill to Medicare or Medicaid without complying with their requirements. Is that right?
I think this is a common sense thing, but it's not my area of expertise.
Are you also aware that it's a legal thing?
Oh, yes, it would be fraud, sure.
Right. It'd be fraud if you submitted a bill that wasn't in compliance with Medicare, Medicaid, or CMS requirements, right?
Yes, but this is not my area of expertise. It's not something I would be discussing.
I understand.
Are you still waiting for the time?
Sir?
Are you waiting for the time?
No,
Oh, okay.
she's going to put that in the record.
Oh, okay, got it.
We moved on. When we're talking, she's taking it down.
Okay.
Have you seen any videos of Arlina Addison?
No.
I got something today that suggests you got certain information at certain times. Let me see if I can find that. We'll mark this. I believe this is this 10, Madam Court Reporter?
That's correct. I still need 9. Oh, I think you uploaded 9. Sorry.
Okay, I apologize. I was a little slow. It looks like you were testifying earlier, February 2025, looks like February 21, 2020. Can you see this all right? Make it a little bit.
Okay.
Sir? What's that?
Yes, thank you.
And it reads complaint, affidavit, medical records. It reads radiology records. And by radiology records, you're talking about films, right?
Yes.
And you got these from Mr. Bomar or someone in his office back in February 2025. Is that right?
Yes.
And then 318 progress note, Amy Dingra. That's the MOCA reports. Is that right?
Yes.
Okay, but you didn't review that because that's outside your area of expertise, right?
No, I reviewed everything that was sent to me, but I'm not going to comment on anything that's not in my area of expertise.
Okay. And then on April 21, 25, you get depositions of Amy Dingra, Einar Odestat, and Amy Dingra again. Is that right?
Yes.
And then the deposition of Keith Sanders, taken on May 29, 2025. You got that on June 4th.
Yes.
And it looks like on June 13, 2025, which is, what is today? The 26th. So just a couple of weeks ago, you got Dr. Lee and Nurse Dudley's depositions. Is that right?
Yes.
Well, why did you not get those for 4 months?
Oh, I don't know. That's not my doing.
All right. And then on June 18th, that was just a week ago, you got the fluoro guided image, or OrthoAtlanta, the one that we just reviewed. Is that right?
Yes.
Okay. But before you got that image on June 18th, you'd already decided that the where the diagnosis was subarachnoid hemorrhage or brain bleed, to you, it wasn't blood, it was contrast, right?
Yes, it looked like contrast to me.
Okay. And I don't see Dr. Harper's deposition on here. Do you, any idea why you weren't provided that?
No.
Okay. Is that something you would want to be provided?
Well, you've sparked my interest, so I'll read it if it's sent to me.
Okay. Have you seen any images or videos of Arlina Addison?
No, you actually just asked me and I said no.
And the answer is none, right?
Correct.
Now, you wouldn't be able to correlate clinically what's going on with her. Is that right?
That's not my area.
Okay. So if her neuropsychologist, her neurologist, her psychiatrist, you would defer to them on what her current issues are, right?
Yes.
And you would defer to them on their belief regarding what caused her issues. Is that right?
I would certainly defer on anything clinical. Yes. The only thing I would comment in is the radiology and the procedures. Yeah.
Well, the only thing you would comment on is that you would say that where the radiologist and neuroradiologist describe blood and subarachnoid hemorrhage, you would say that that's contrast, not blood. Is that right?
Well, that's certainly one of the things I would talk about. Sure.
Well, we'll show you what's been previously marked as Exhibit 10.
Is this a new one?
Oh, no, I apologize. Is this 11?
Yes.
Thank you. Show you what's been previously marked as 11.
Mhm.
Show you what's been previously marked as Exhibit 11. Do you agree that that exhibits decerebrate posturing?
I have no opinion on this. It's not my area.
So you don't know what decerebrate posturing is then?
No, it looks like decerebrate posturing, but I'm not going to comment on it. It's not my area.
Okay. Have you ever used dexamethasone?
No.
Okay. Have you reviewed any articles regarding this case
No.
or in preparation for your deposition of this case?
No.
Are you familiar with articles that talk about sequelae of subarachnoid hemorrhages?
Oh, sure.
You agree that subarachnoid hemorrhages can cause severe cognitive impairment?
As a generality, that is correct. Yes.
And they can also cause severe brain injuries, right?
Yes. As a generality, that is correct. Yes.
Show you what's been previously marked as Exhibit 12. Let me send 11. This is Reed's second supplemental response. This is you, Dr. Say, is that right?
Yes.
This is what you're planning on testifying about. Dr. Say opines that the initial CT image from June 9, 2022 reveals presence of air and blood / contrast. Do you see that?
Yes.
And that's your view? Is that
Yes.
right?
Well, I think it's contrast, but yes, it does say blood/contrast.
Well, you agree it's blood/contrast.
Well, I think it's primarily contrast as we've been discussing.
So it's no longer blood, it's now just contrast, is that right?
Well, I can't say that there's no blood, but I think it's essentially mostly contrast.
Okay, so it's your testimony that it's what's in the CTs, the CTAs, and the MRIs is a combination of blood and contrast.
Essentially, mostly contrast. There may be a little blood.
Okay. It's blood and contrast, mostly contrast.
Yes.
And it's in the subarachnoid space, but this resolves and Miss Addison should not have any permanent injuries. Is that what you believe?
I would say that Mrs. Addison does not show on imaging any permanent injuries.
Okay, but you would defer to the clinicians regarding that.
Regarding the clinical, yes, I would defer.
Okay. Well, regarding the sequela, what they observe, what they're caring for her for, what they're treating her for, right?
Yes.
Reads temporary reaction to an irritation, and by temporary reaction to an irritation, you're talking about the irritant being the contrast, is that right?
Yes, the foreign substances.
Okay.
And the air also.
What's that?
And the air also.
Okay. And have you made a determination about how the drugs, the air, the saline, and the contrast, if any, increased her intracranial pressure and what that was compared to her cerebral perfusion pressure?
Well, I have in the sense that I've read what Dr. Odestad said in his deposition and looked at the amounts that were given.
And do you agree that for a period of time, she was not getting oxygenated blood to portions of her brain?
You know, that's a clinical thing. That's not my area. I do not see ischemia in this case.
Okay. But you would defer to a clinician for that, right?
What I would say is I do not see ischemia from an imaging point of view. And stroke, MR is very, very good at strokes.
You agree that you can have ischemia without being able to see that on an image, right?
You can have what we used to call a TIA and not see anything on an image, yes.
Reads here, you reviewed the subsequent imaging and upon that all subsequent imaging is normal with no evidence of brain injury.
Yes.
You're talking about everything after June 9th, is that right?
Maybe not June 9th, but certainly, let me see. I mean, June 10th, the CT is not totally normal. There's still some air.
Right.
And then basically, July scans are normal.
Okay, and you agree that those normal scans do not rule out brain injury and do not rule out cognitive impairment, right?
Well, we discussed this at length. It depends what you're talking about, but it is possible.
Any other opinions that you haven't shared with me today?
I don't think so. I think that that's pretty much it.
Okay. Do you agree that if the dye went to the brain, that the steroid also went to the brain, right?
Oh, sure, conceivably.
You agree that that can also have devastating consequences, right?
Object to form.
That's not really my area.
Okay. For contrast to show up, I mean, which it was diffused throughout the brain, as we described on the images, how much contrast would that take?
Not very much.
Okay.
In other words, the 3 millimeters certainly could do it.
Well, the 3 millimeters, we were looking, you agree that the triangle, we can pull it back up, the triangle shape and the thoracic, near the thoracic spine, that never made it to the brain, did it?
No,
Okay. So, and how much was that triangle shape?
oh, that was very little. Can't tell you how much, but it's very little.
So that would, so at most, I mean, if any made it to the brain, it would be what was injected less the triangle shape, right?
Yes.
You agree that if CMS is Centers for Medicare and Medicaid Services required both an AP and a lateral view in order to charge for an epidural steroid injection, then that's what you would do, right?
Dr. Form.
You may answer.
I have no knowledge of this, so it's really not my area.
I think we were talking about complying with federal law. You comply with federal law when your hospital bills for your services.
Billing is not my area, but of course I assume so.
Would you bill the federal government for work you didn't do?
No, that would not be legal.
Okay. What are signs and symptoms that you're aware of that patients suffer as a result of subarachnoid hemorrhage?
Oh, that's not my area. I'll defer to the clinical people.
Okay. Are you aware of her being on medications that she was not on before June 9, 2022?
Oh, that's not my area.
Okay.
I'll defer.
Do you recall Dr. Lee testifying that under oath that he injected very little contrast that day?
I just remember the 3 milliliters. I don't remember. I mean, 3 milliliters is not a big amount.
Do you recall? I mean, you read his deposition, right?
Yes.
Do you recall testifying in the Tylenol MDL that you were not qualified to diagnose liver failure or sepsis?
Yes, that's correct. It's clinical.
You still gave it an opinion on what a CT scan said about it?
Yes, I don't remember at this point. What I certainly didn't comment on the liver.
You
Did I?
testified, I apologize.
No, I'm finished.
You also testified you'd never offered such an opinion before. Is that right?
About Tylenol and the brain? Probably not.
Okay. Well, tell me every case where you've ever offered an opinion that, subarachnoid hemorrhage, or what was diagnosed as blood in the brain, blood of the skull, was actually contrast.
I don't think it's ever come up before.
Okay. So you've never testified on that before, right?
I don't think so.
Never written an article on it?
No,
Never written a piece in a textbook about it?
no,
Never written a peer-reviewed article that
No.
dealt with it, or non-peer-reviewed article, right?
no,
No grand rounds?
nothing.
No, okay.
Mr.
So
Park, do you have a lot, do you have a lot more to go? Because otherwise I'd like to take a bathroom break. But if you don't have a lot,
no.
if you don't have a lot more, I can hold.
10 minutes? What do you want?
How much more do you think you have?
I just have to finish up my outline, but a lot of this we may have covered, so I can't really tell you. Half an hour maybe?
Terrific. We can make it 5 minutes. Is that okay for you? Maybe.
Yeah, let me, I mean, between 5 and 10. I mean, you don't have to be back at like, okay?
Okay. Great.
Going off the record at 6:11 p.m. We're back on the record at 6:19 p.m.
Dr. Say, did you speak with anyone over the break about your deposition?
No,
Did you speak with Mr. Bomar?
no,
Anyone in his office?
no.
I'd like to talk with you briefly about how long things stay visible on a CT scan.
Sure.
Contrast dye, it clears quickly, doesn't it?
If you mean intrathecal contrast, yes, it goes away quickly.
Yeah, and that's on purpose, right? You don't want it to stay around, right?
Probably not.
Sir?
Probably not.
Right. So contrast dye, it clears within hours, not days, right?
No, I don't think that's correct. It depends how much is given. Again, I have a lot of experience with this because I come from an older era. No, it can stick around for at least a day or two, at least minimum. It depends how much was given.
Okay. So your testimony is it would be a day or two that would stay around?
No, my testimony is it depends how much is given.
Okay. Well, you agree that we've got scans for 4 days and then some, right? We looked at them earlier.
Yes, I mean, we typically, for example, in myelography would give like 10 milliliters, 10 cc's, or even more. So, that sticks around a long time. So multiple.
10 cc's would stay around how long?
I can't give you an exact time, because it depends on a lot of variables, but certainly days.
Yeah, I'd like for you to cite for me any treatise, textbook, chapter in a textbook, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaways, anything in the history of medicine that said that contrast would stay around for several days.
Now that's intrathecal contrast, which is different from contrast in the vein. I don't have anything offhand. I could look it up and see what there is in the literature.
And now I'd like for you to, same thing, cite anything in the history of medicine that says the amount of the contrast would dictate how long it would stay around.
Sure, I can take a look in the literature and see if there's anything.
But as of
this would be old stuff.
now, there's nothing. Is that right?
I'm sorry?
As of, you can't cite anything right now. Is that right?
Say anything now.
Okay. You agree that contrast is often gone completely within 24 hours?
When you talk about contrast, I think you're talking about contrast in the vein. Yes, contrast in the vein basically resolves quickly. But intrathecal contrast is totally different.
Okay. And can you cite for me any literature? Again, talking about days instead of hours or a day.
I cannot cite for you anything sitting here. I can just cite for you my experience.
You agree that blood is different from contrast?
Yes.
You agree that acute subarachnoid blood can linger for days, sometimes over a week?
Oh, yeah. It depends how much is given.
And it doesn't just disappear. It fades gradually, right?
Yes.
And you agree that in those films, I can pull them back up, but we looked at over 4 days how what was in those films faded gradually, right?
Yes.
Okay. And that's what blood does, right?
Yes.
It doesn't just disappear,
Right.
right? And you agree that it's hyperdense on day 1,
Yes.
less dense on day 2,
Yes.
less dense on day 3,
Yes, or sometimes gone.
and less dense by day 4, right? And that's exactly what we had, precisely what we had in the films we reviewed earlier in your deposition today, right?
It is what we saw today, yes.
And that's the natural evolution of blood, not contrast.
It is
Right.
the evolution of both.
Okay, and is your testimony that contrast dissipates like blood?
We've discussed this. It depends how much is given, and we're talking about intrathecal contrast. We're not talking about we're not talking about IV contrast, intravenous contrast. We're talking about intrathecal contrast. It depends how much is given.
Well, you agree intravenous contrast clears the body quickly, usually within minutes to a few hours, right?
The half-life is roughly 6 hours.
Okay. And it's the same, and intrathecal contrast dye stays longer, but that's only if someone did a spinal tap or injected dye into the spine, right?
Yes.
And that didn't happen here, right?
Well, it wasn't purposeful.
That didn't happen here.
That somebody did it. Well, we've discussed this already, and I think that.
No, we haven't, doctor. I wanted to answer my question.
No. Let me just finish. I mean, I think that I acknowledged that Dr. Lee nicked the dura, and some of it went intrathecally.
Yeah. Well, you agree if it's not contrast and it looks like blood and it evolves like blood, it's blood, right?
Back to form.
If that were true, then the answer is yes. It can be difficult to differentiate the two, but as I said, I think this acts more like intrathecal contrast.
So if you're still seeing something still visible on day 4, it's something that's fading. You know, it hasn't gone, right?
Yes.
And that points to blood, not contrast.
No, I think you've asked me this already. It depends how much is given, and it depends on multiple variables.
And the less that's given, the more quickly the contrast is gone. Is that right? Is that right?
Yes.
Okay. I'm going to show you what's been. I apologize, Madam Court Reporter. Buddy, what's is this 12, 13,
13.
27? Show you what's been previously marked as Exhibit 13. I think you testified you just recently received Dr. Lee's deposition. Is that right?
Yes.
This is page 122. Can you see that? Of Dr. Lee's deposition?
Yes.
And it reads here, it looks like omnipaque. Do you see that? That's the only thing that could possibly be in his skull, right?
Yes.
And that's because if anything was given, that's what it was, right?
Yes.
It reads here 180 milligrams iodine intrathecal solution, 3 milliliters local surgical site. You see that?
Yes.
And you recall reading that question?
Yes.
And you recall his answer?
3 milliliters.
Well, let's have that's what you think you remember?
That's what I thought I remembered. Yes.
Let's have a look. Answer. So what that means is 3 milliliters was drawn up into a syringe, not all of which needs to be used. You see that? Can you hear me, doctor?
Yes.
To answer my question. In fact, in a 3 milliliter syringe that is full of dye, I often use the least amount of dye necessary to convince myself of safe needle placement. Do you see that?
Yes.
And according to the medical record, where it reads a dose was 3 milliliters, right? According to the medical record, but oftentimes I will use less than what's in the syringe. Maybe a half cc to 1 cc. Do you see that?
Yes, I do.
And you agree a cc stands for a cubic centimeter, right?
Yes.
And a cubic centimeter is the same as a milliliter, right?
Yes.
So what his testimony was is that if he followed his ordinary practice, he would use between 1/2 and 1 milliliter, right?
That's what he said.
And you didn't remember that, or you just chose not to share that today?
I didn't remember that because he said, but I remember the 3 milliliters.
Yeah, well, but now you remember it's a 1/2 milliliter to a milliliter, right?
Well, that's what he's saying here. Yes, oftentimes.
Right. Well, no, that's his standard of practice.
Back to form.
Well,
Sir.
I think it's.
And I think you testified just a moment ago when I asked you about whether the quantity of contrast dictates how quickly it disappears. You said yes, right?
Yes.
And you testified, you gave me an example of 10 cubic centimeters, 10 milliliters, right?
Yes.
And you said that could hang around for days, right?
Yes.
And if we're talking about 1/2 of 1 centimeter, cubic centimeter, we're talking about hours, right?
No, we're not talking about hours.
Okay. So when you testified a moment ago under oath that, the amount, the variable amount dictates how long the contrast hangs around, has that changed in the last couple of minutes?
No,
Okay. So if 10 milliliters could hang around for days, you agree 1/2 of 1 milliliter could be gone in 24 hours.
I don't think that's necessarily so.
But possible.
It's possible, yes.
Okay. And according to the medical record, where it reads dose, the dose was 3 milliliters, according to the medical record, but oftentimes I will use less than what it's in the syringe. It may be a 1/2 cc. And you agree a 1/2 cc is the same thing as 1/2 of 1 milliliter.
Yes, I do.
You agree that decerebral posturing is almost always fatal?
Not my area.
Okay. Do you recall whether the patient that you saw exhibit decerebral posturing some 40 years ago survived that event?
Oh, I don't remember.
Okay. It indicates injury to the midbrain or upper pons.
I'll defer to the clinical people.
Okay. And you're aware it occurred within 2 minutes, not hours, not days, right?
What?
The decerebral posturing occurred within 90 to 120 seconds, not an hour, not hours, not a day later, right?
Yes, we discussed this, yes.
You agree that without a lateral view, no matter what you're doing, you cannot tell the depth of a needle?
Object to form.
I don't think that's quite true. It's harder, but I don't think that's quite true.
You've watched movies, right?
Yes.
Have you seen any John Wick movies?
No, I actually haven't.
Okay. Have you seen, there's a television series, what is it called? You've seen movies and television series where they throw punches
Sure.
and it looks like somebody's actually physically hitting someone else.
Yeah.
And you understand that's not the case, right?
No.
And the reason that is because you're looking at one plane, let's say AP, right?
Actually never gave it that much thought, but you may be right. Sure.
And if it could be the actor who's, appears to be struck is actually a foot back. So the swing and you can't tell because you don't have the lateral view, right?
You know, I never thought about it. I was wondered about that, but thank you. Now I've learned that. Thank you. That I never knew that, but that makes sense.
Okay. So you agree that without that lateral view, you can't tell the depth, right?
Certainly harder.
What?
It is certainly harder.
Well, how is it possible?
How's it-
Arm.
Well, because you hit certain things on your way in. So when you hit certain things, you know how deep you are.
Well, if you hit something, it's too late.
No,
You
no,
put a cervical epidural steroid injection.
it depends what you hit.
Well, if you hit the cerebral spinal fluid, it's too late, right?
For a cervical epidural injection, that is too deep, yes.
Okay. I'm just going over my outline. I think we're done. I just
Thank you, thank you.
unless you want to do this again and again, which I'm confident you do not. Nor do I.
It's time for dinner.
Sir?
I
Yeah.
said time for dinner.
You agree that the brain does not generate air spontaneously?
Yes,
And the only procedure she had that day was a CESI?
yes,
Have you worked with Mr. Bomar before?
no,
Okay. Have you worked with his firm before?
I don't think so.
Anyone in his firm?
I don't think so, not to my memory.
How did he get your name?
I don't know.
Okay. You do work for other defense firms though, right?
I've also worked for plaintiffs' firms.
Okay. What
In-
plaintiffs firms have you worked for?
Oh, boy. Now that you ask me, I'd have to think about that, but I actually was, anyway, yeah, I have certainly worked with plaintiffs firms. It's about 50-50 of what I've done. So I've certainly worked for plaintiffs firms in Georgia. In fact, I was actually in a trial there, now that I think about it.
What?
I was in a trial there,
Oh, in Atlanta?
well, suburb of Atlanta.
I don't know. DeKalb County? Fulton County?
I think it starts with a C. Does that make sense?
Cobb County?
No, I don't remember, but it was a plaintiff's case. Yeah, I was on behalf of the plaintiff.
Do you remember what firm? You don't?
I do remember that it was an out-of-state firm, but I don't remember who the local counsel was.
Okay. Have you ever worked with Tim Benden's firm? Tim Benden, Sumrall, and something, I don't know.
Oh, that name is vaguely familiar, but I haven't worked with him in a long time, I don't believe.
But you have worked with, and that's another firm in this case, I think.
Oh, is it? Okay, I think so, but not for a long time.
All right.
Oh, I know. Mr. Malone. I've worked with Mr. Malone. And
Tom
also,
Malone or Tom Malone?
it's Malone Law. Does that help?
Yeah. Well, it's his son now. Yeah, I know.
Oh, okay, and also, oh, I'm sorry. The name sounds like they're two first names.
I don't know, man.
It's a B, I think. It starts with a B. It's sort of an odd name.
Bill Bird?
No, it's like two first names. Daniel, does that make sense? Daniel? Something Daniel? Does that
Have
make-
you done work for Hall Booth?
Yes, I have worked with Hall Booth, mostly in Florida, though.
And what about Dan Huff Powell?
Yes, I have reviewed cases for Huff Powell.
Okay. And what about Kevin Race?
That does not ring bells. Tolson?
Sir?
Tolson firm? Tolson?
I don't know.
Butler Daniel.
Who?
Butler Daniel?
Brother Daniel?
Butler, Butler.
Butler Daniel. Yeah, I don't know. That's a plaintiff's lawyer?
Yes.
So you do a good bit of expert work?
I'm restricting it. It went down during COVID and then it went back up, and now I'm restricting it.
I think it looked to us like there were, over 10, 12 or more cases that you were working with in Atlanta or Georgia. Does that sound about right?
Boy, not currently, I don't think. Over years, not currently, I don't think.
Okay. All right, that's all I have.
Thank you so much, Mr. Potts.
Yes, sir.
Olivia, do you have any questions?
Nothing for me.
Okay, I have no questions, Dr. Zay. Thank you for your time today.
Thank
Be
you.
safe.
And I would like to read and sign.
All right. Do you know Norm Pattis, a friend of mine, and Norm Pattis?
How
He's
do
in New Haven. I don't.
No, I don't. I don't look at Connecticut cases at all.
Got it. All right. Thanks again. Bye-bye.
Thank you very much. Thank you, everybody.
Yep.
Bonnie, do you need anything from me?
We're going off the record at 6:40 p.m.